Hi, Professor Swift. I'm with Megan again. I'm at work, but we're in an empty room, so I'm going to leave my mask off so you can hear me. And so now I'm going to be beginning my checkoff. Hi, Megan. My name is Whitney. I'm going to be your nursing student today, and I'm going to be looking at your cardiac and your peripheral vascular system today. Is that all right? Yep. Okay, so I'd begin by washing my hands, and I'd be sterilizing my stethoscope. So, a couple quick questions for you. Have you had any history of cardiac issues?
Nope.
Any issues with your peripheral vascular system?
Nope.
Okay. How about any shortness of breath or issues breathing at night?
No.
Okay. And so I don't know any sort of visible dyspnea. And then looking at her skin color, it is even and it is a light tan and is evenly distributed, no sort of blotching. So no abnormalities noted. And now, oh, and then I also want to ask you, I already asked you that, never mind. So now I'm going to be looking at her precordium. So if you will lay down for me, if you will raise your shirt up a little bit. Okay. So I'm going to shine the pen light since I don't have a lab lamp. Okay. All right. So visible pulsations are noted. And I'm just going to go ahead and tell you the points now so we can just get those over with. So your aortic is going to be at your second intercostal space on the right side border. Your pulmonic is going to be your second intercostal space on the left border. Your herbs is going to be the third intercostal space, left border. Your herbs is going to be, I just said that, tricuspid is going to be fourth intercostal space, left border. Your mitral is going to be the fifth intercostal space, midclavicular line. So now those are all out of the way. So the next thing I'm going to be, and the PMI is at the fifth intercostal space and the left border. So the next thing I'm going to be looking at is the amplitude. So I'm just going to give it a gentle tap. Okay. All right, so no abnormalities noted with the amplitude. And it should be about no more than 1 to 2 centimeters. And now I'm going to be up, let's see, epigastric region. I'm going to pinch and see if there's any sort of pulsations with that. So I'm going to lift up your shirt. Is that okay? All right. Okay. So when I am pinching her epigastric region, I'm looking for any sort of visual pulsations. I didn't note any. And so now I'm going to auscultate. So we're going to be doing the same points as what I just described. And so first I'm going to be using the diaphragm, and then I'll be using the bell. So, let's see, Miss Megan. All right. Sorry. Megan?
I'm so sorry.
Okay, so she has really great heart sounds. I did hear hear S1 and S2, but I don't hear any extra heart sounds, so no S3 and S4. There are no splitting noted and no murmurs noted. And so now I'm going to be checking her apical pulse for a full minute. So let's run it. All right, I'm going to use my phone. All right, Megan, I'm going to lift your shirt up again. Okay, so I counted 68 pulses per minute, and they were great heart sounds once again. And I also realized that I did not listen with the bell, so I'm going to do that real quickly. All right, Megan, sorry. All right, aortic. Okay, and once again, when I'm listening with the bell, I didn't hear any sort of any murmurs, extra heart sounds, or any splitting, so no abnormalities noted. And once again, for the apical, it was 68 beats per minute, and there was a regular rhythm, so no abnormalities or regular rhythm noted. So with that completes the heart check off. So now I'm going to be looking at the peripheral vascular system. So first I'm going to be looking at her skin color. So I'm just going to lift up your pants a little bit. And then if you'll roll your, there we go. Okay, awesome. So skin color, evenly distributed. It's a light tan color. And if we had any sort of abnormalities or uneven distribution of skin color, it would be probably a retention of fluid indicated with shiny skin. Looking at her hair distribution, she does have even hair distribution on arms and legs, so no abnormalities noted. With her, and now I'm going to be just looking at her evenness bilaterally of arms and legs. Okay, all right, awesome. And so her arms and legs are equal bilaterally. And the next thing I'm going to do is looking at her pulsation on both sides minus the carotid artery. I'm going to do that one at a time. So first thing is radial. So okay, radial is 2+. Brachial is 2+. Okay. Okay, carotid is 2+, and once again you do that so you don't cut off circulation. Then femoral, I'm just going to do it at the bend of her leg. Okay. Okay, 2+ for her femoral, and then for her dorsalis pedis. Okay, and so dorsalis pedis is 2+, and then for her posterior tibialis, I'm going to do the outside of her ankle. Okay, and for her posterior tibialis, that is also 2+. So regular rhythm, all of the pulsations are noted on all points, so no abnormalities. And as for skin temperature, I'm going to be feeling with the back of my hands. We want it to be warm bilaterally. And if there was an uneven temperature, that would be indicative of any some sort of circulation issue. So I'm just, will you flip chairs for me? Thank you. Okay, so she has a warm temperature bilaterally and equally. And so the next thing I'm going to be looking at is for any edema. I'm going to check on the dorsum of her foot, her shin, and her medial malleus. So dorsum of the foot is at the top of her foot, holding for 5 seconds. Okay, so immediate return. I'm going to check on her other one. Okay, immediate return for her shin. immediate return, immediate return, and medial malleus. I'll start with this. Okay, immediate return and immediate return. Okay, so no edema noted in any of the 3 spots. And now I'm going to be looking for a Homan sign. And so I'm going to bend her knee and pull her foot towards her knee. And we're going to be looking for, normally with no abnormalities, she shouldn't have any sort of tenderness or pain. But if there were to be, it would probably be indicative of any sort of blood clots. So I'm just going to put this right here. Does that have any pain or tenderness?
No.
Okay. I'm going to do it really quickly.
No.
Okay, awesome. So she said she has no pain or tenderness with testing her Homan sign. So no abnormalities noted. And I have completed my checkup.